everybody, happy Wednesday. We are back for another fertility Q&A live, and we're going to be joined tonight by Dr. Jessica Bauer of IVFMD. We have a lot of good questions. We're going to actually be digging into those, and if you haven't submitted, you can still submit your questions in the chat. I'm excited to have her perspective here. I just saw her pop up, so bring her in, and let's see if we can have her pop up there on the screen. Hey, how are you?
Good. How are you? Nice to see you.
Welcome back. You too.
Oh, thanks.
So we were like, wow, we were so excited because we saw there were like 20 something questions already submitted today. So
Yeah,
so we're like gonna
amazing.
dive in. Yeah. Like, that's great.
Absolutely.
If you could introduce yourself also for anybody watching.
Absolutely. Hi, everyone. I'm Dr. Jessica Bauer here again with IVFMD, working out of the Boca Raton office and the Jupiter office and all the offices. No, not all the offices, but mainly out of the Boca Raton office. And happy to be here and can't wait to dive right in and answer some questions.
Awesome. And I love that your expertise is also with nutrition and, fertility and OBGYN and so many things. So, so if you guys didn't get a chance to ask your questions, you can type it in the comments as well, and we will go back and forth and get to those questions. And I'd also like to mention that if you don't want to talk, publicly, you can actually message us, or you can request a consultation as well. That you're still doing virtually, right?
Absolutely.
You guys are still doing
Virtually,
virtual
also, also in person,
yeah.
whatever. We're doing it
Yes.
all.
Yeah. So whatever is easier for you. And we also do virtual phone, like 10-minute phone consults as well, just to answer any questions you might have. Because a lot of times acupuncture is new for a lot of people. There are many people that come to us that have never had acupuncture before, so they have a lot of questions. That's understandable. And also about when to do what and that sort of thing. So we'll also answer some of those. And my name is Farah Duro. For those of you who don't know me, I am a licensed acupuncture physician and reproductive acupuncturist and herbalist, and we're in Hialeah Gardens, so we're not far from Broward, or as we relocated from Broward recently. So we're not that far from Broward, and also I know you're a little bit further north from us, but we are close to Miami as well. So so I hope everyone is doing well tonight and would like to settle in, because this is going to be intense. So we've got a lot going on here. But yeah, grab some tea and share this with a friend who might be struggling, because I think that this is such important information, and a lot of times we don't get a chance to share it. We are all busy, so it takes a lot of time to try to figure things out. A lot of times when you're struggling with fertility, and you're kind of looking at what your friends maybe are doing, but maybe that's not the exact situation you're in. So it's very individualized. That's what I like about what you guys do at IVFMD, because it's definitely not cookie cutter. It's basically taking the person as an individual, similar to Chinese medicine, and finding out where the problems lie before just jumping right in to an IVF cycle.
Absolutely.
Or anything like that. So okay, so we'll get started.
Yeah.
So let's see, we'll talk about the tubal questions first, because we do have a question on that.
Okay.
So patient has 1 tube, previously able to conceive with it after an HSG. She's been trying 18 months. Should she get another HSG?
So it is definitely true that the month of an HSG and generally the month after an HSG, there has been shown to have definitely there can be an increased chance of pregnancy, because the actual action of putting the fluid through the tubes and flushing them out can sometimes flush out some debris or anything that could be, preventing things from happening. That being said, if you had one 18 months ago, I would say generally I like my HSGs to be within a year, to be to be accurate and up to date, because certainly things can change over the course of a year, especially if you've had any sort of infection or even a pregnancy or any sort of change in your medical status. And So that may be one thing, but it also may be more important to consider looking at other things, like a semen analysis for your partner, or making sure that you get your ovarian reserve checked as well. So it's a little hard to say without knowing a little bit more about you, but certainly it is definitely a good idea. HSGs can help improve things because they give you information about the tubes and because they flush the tubes out. But there are a lot of other factors. So, depending on how long you're trying and how old you are, I would say, it might be time to maybe seek some additional advice.
Definitely. And we just actually recently had a patient who got pregnant after doing an HSG, so that was great.
Yeah, it
Wonderful.
happens. It happens for sure.
And an extra benefit. So
Yes.
as far as we have another question. Can I have IVF if I have endometriosis? I have 2 kids, but also had a tubal ligation done.
Absolutely. In fact, a lot of women with endometriosis end up, needing IVF for sure. Sometimes, it's clearly, not necessarily in your particular case because you have 2 children, but some women with endometriosis can have decreased ovarian reserve for their age. It's part of the pathology or the disease process of endometriosis, and sometimes that then requires that IVF be done. And certainly when in your case where your fallopian tubes are tied, you certainly would need IVF to conceive, for sure. But having endometriosis does not mean that you can't have IVF. In fact, sometimes it often means that you do need IVF. So definitely a possibility for you. I'd love to, and whoever that is, I'd love to see you and we can talk about it more.
Yes, for sure. So that's she was asking, can I do IVF if I had a tubal ligation? And you can, yes, definitely.
Absolutely,
Yes.
absolutely. And in fact, it's for people used to consider, and they still do. You can consider getting your tubal ligation reversed. However, the likelihood of success is very much higher when you do IVF compared to trying to do a surgery where you reverse the fallopian tubal ligation, for sure.
Yes, definitely. You don't need the tubes for IVF, for sure.
Nope, no tubes.
So another question, 22 to 23 day cycle, ovulation usually day 11. Is that too short? Can acupuncture help with this?
So yeah, I can address the part about the cycle for sure. So a normal menstrual cycle can fall anywhere between 21 days up to 35 days. So you're certainly falling into the normal range, and it makes sense that you have a little bit of a shorter cycle, and so you're ovulating a little, maybe a day or 2 earlier than someone who has a 25 or 28 day cycle, something like that. I don't think ovulating on cycle day 11, as long as it's regular and consistent, is a problem.
Yeah.
And then I'll let Dr. Duros speak more about acupuncture and how it affects the menstrual cycle, because I know it can definitely be super helpful.
Yeah, I mean, it looks like they're having a 12-day luteal phase, right? If they're
Yeah.
not. And we try to work with the body with herbal medicine and acupuncture. We've seen the cycles lengthen a little bit. Someone is going on the shorter end, which is not bad, so it can help. And definitely that's one of the questions that someone asked is if acupuncture can help with cycle regulation. And we have definitely seen that. And one of the explanations might be that, in Chinese medicine, we have yin yang balance, temperature balance. So if someone's overly warm, we say, or yin deficient, they typically are ovulating early. And we see that some of the herbs are actually cooling. Some of the acupuncture points are meant to be slightly hormone balancing. So they can actually have a little bit more cervical mucus and a little bit longer follicular phase when we start lengthening that out a little bit with the herbs. So it's kind of an interesting process with herbs. You can use them depending on what week of the cycle you're on. It's going to be a different formula is basically how we address it. So so that's something that we see, but definitely patients can have healthy ovulations, a little earlier, right? As long as the follicles
Yeah,
not
no,
sure.
absolutely. You might just be super efficient getting your follicle where it needs to be
Yeah.
before it ovulates. So it's not necessarily a problem. If it gets much shorter than that, shorter than a 21-day cycle or longer than a 35-day cycle, then it might be worth looking into more.
Definitely. Yeah. And if your cycles have changed, like what if they were 30 days now
Yeah,
they're going towards the shorter end, then you definitely should get your hormones checked anyway. So
yeah, absolutely, 100%.
so we have a couple of acupuncture questions.
Yeah, hit it. Let's do it.
Yeah, and it sounds like the person who asked this question, she says her acupuncturist believes I could get pregnant naturally. Should I push back IVF a month or two? Um, and that's always a personal choice with with the couple. I mean, I think that I usually like to see patients like 3 months prior at least to their doing IVF if possible. And that gives everyone time to do workups and, all the nutritional things that can help with egg quality and all those things if possible. Everyone's case is different, but so I don't know exactly how long you've been doing acupuncture and, but if, sometimes time is of the essence also with IVF, but it's good
Yeah.
to, try at least for a few months if you have that luxury, and but it's hard to say. Yeah, like I said, some of these questions it's hard because we want to ask more questions to you guys. So
Yeah.
it's like we can just we're limited with what we can say, but definitely I don't think it's going to hurt to do another month or two of acupuncture usually.
Exactly. Yeah. No, fertility generally, obviously, like as you said, I echo the sentiment that, sometimes time is of the essence. But if you're talking about a month or two, your fertility changes over time. It doesn't
Yeah.
change by the day. And
Goodness.
so yeah, and so just weighing the risks and benefits for, what's right for you and your partner, and speaking about that with your doctor, I think it's perfectly reasonable to consider trying another couple months of acupuncture if your doctor thinks that that's okay and you're comfortable with it, for sure.
Yeah, definitely. I'm actually doing my CEUs for my license renewal
Oh.
and there's the an integrative fertility symposium we're doing. It's on
Ah,
watch. I'll just share you some of those slides because they're awesome. But one of
absolutely.
Ari, who's an acupuncturist, so and
Nice.
incorporates acupuncture nerves into her patients' protocols before starting stimulation. She's in Austria, but they have an interesting way of working with the patients there. And she also really encourages the partner to come as well. So she says, look, I see differences. We need, she checks with ultrasound, obviously, when she's doing acupuncture and all that. So I think it's pretty interesting.
Absolutely.
So yeah, now we also have a question about can acupuncture help after a biochemical pregnancy? And in general, I mean, it's sometimes there's not really a reason why that didn't work, and so I think that acupuncture is one of those treatments that helps a lot with stress reduction, and it's one thing that can also help with in general circulation. So if there's any issues with that with circulation, or obviously after a loss, and no matter how early or late it is, it's still painful. So I think that it's good to do some self-care. So in general, those things can be helped for sure. And then I would, if this is something that's happened more than once, I would look into why it's happening, definitely, and use that time maybe to do some workups and that sort of thing as well.
Agree 100%. Yeah, biochemicals are super frustrating. They, get your hopes up and then seemingly change, in the blink of an eye, and things, come down very quickly. But they can be, they can be sort of like, they can be a symptom of something else, so I think it's a good idea, like she said, if you're, having one is very common. Having women having miscarriage, at least a miscarriage, is exceedingly common. But if you're looking at two or more, I definitely think that it's worth investigating if you feel comfortable, for sure.
And so the other thing is, as far as someone asked another acupuncture question, so I'll just follow up with that. What are the benefits that acupuncture does for fertility? it's kind of ties into that as far as wherever you are going. Usually, if you're going to someone who works with fertility or works with patients who are pregnant as well, we are looking for points that are going to help with blood flow, because that's also good to do during pregnancy as well. General. We have different protocols for wherever you are in your cycle, and also whatever treatments you're doing. So the benefits usually for that our patients see are generally better response to medications because of that improvement in circulation. And then also, if we can have time, like it takes time, 3 to 6 months to work with patients on egg quality issues, we do see with time the improvements in embryo reports sometimes. So we see a little bit more follicles that they can actually get retrieved, sometimes just a increase sometimes in the lining. Sometimes it's by a millimeter or two, but it's better than
That makes a difference.
yeah. Usually fertility doesn't, it's not like wine, it usually doesn't get better with age. It tends to kind of like, sort of stay the same or get a little worse. But with acupuncture, we kind of are trying to turn back the clock a little bit and do things that can help you respond to whatever treatment you're doing. So, that, and then we also have the mental benefit of helping with anxiety, which is rampant.
Yes.
You know,
A huge part of it,
yeah,
maintaining and being
right.
aware of your mental status and your emotional status through every fertility journey, regardless of how involved it is or not, is super, super important. And so stress reduction and management of anxiety through the use of acupuncture is wonderful, and I recommend it to everyone, truly.
Thank you. Yeah, and I think without, I mean, sometimes it's hard to get through the next cycle if you've had one that didn't succeed. So, or to
Yeah.
prepare mentally for that, is really hard. Or if you've had a loss. So, I think what we try to do is work with the acupuncture prior to and then during the transfer as well, if possible, to do that treatment on site. Because there's some studies about cortisol, and cortisol is a stress hormone. It's basically saying, well, it's better for pregnancy, fertility, implantation if the cortisol is lower. And so acupuncture can usually help with that. It kind of modulates things. So if you're running too high, your cortisol is really spiking up, it can help bring that down. So during a transfer, that'd be beneficial to try
Definitely.
and help the cervix relax and have your mind relax and like try to kind of, ease into it a little more. And so, the next question is, does it help with getting pregnant? It would really be like those same benefits can help, I think in general. And we discussed this last live that we had last week, that you guys, Dr. Gomez, the success rate was running around 80%, I believe, on your frozen embryo transfers for IVF. And we had the similar rate. It's between 85 to 90% of our patients conceive with when we're doing acupuncture during the transfer. So that's the only thing we calculated, was during the time the patients had acupuncture, if they were had a positive pregnancy test. So it's not ongoing pregnancy, but it's positive pregnancy test, and that was 90% actually, because we
Wow.
did
That's great. Yeah.
past year, which this has been a crazy year, so that's pretty good, I think.
Yeah. Look at you lowering all those cortisol levels, those pandemic cortisol levels.
Everything. Yeah. And I think it's you guys too. I mean, you're the best. So if you are going somewhere else, I don't know if it's going to be that good, but I'd say what you guys do, it's I can't speak highly enough of
Thank you.
How you guys.
It's our pleasure, just as I'm sure, it's such a pleasure to help people just achieve their goals and help them along the way. And anything you can do, whether it's, medical stuff on my side or acupuncture on your side and the herbs and all that kind of stuff, it all matters, and it takes a village to get it to work. So.
Yeah. And you're not like sending someone to a transfer before they're ready. I think that's
right.
It's like, wait, nope, sorry, we got to make sure this is right. We're not
exactly
going to do that. And I think that's part of the reason. But another question we have is I've been trying to conceive for some months now. What tests should I get done just to make sure everything is okay?
So that's a loaded question, and it again a little trickier to answer without knowing a little bit more about you. But certainly the general rules, if you are less than 35 and have been trying to conceive for at least 12 months and have not been successful, I definitely recommend that you have an evaluation. You know, we're going to evaluate your ovarian reserve, okay, the number of eggs, you know, that you have, because that changes over time for everyone, but it changes differently. We're going to evaluate the sort of the structural things. Is your uterus okay? Are your fallopian tubes okay? Those are sort of basic things to check that if there's something wrong can really be causing a problem. And then, you know, on the flip side of things, making sure that your partner has a semen analysis to make sure that the sperm count and the quality is appropriate. Those are sort of like just sort of basic things that, you know, that can be checked. We need to check the eggs, we need to check the sperm and their ability to get together, right? And so those are sort of the general first steps to check, excuse me. There's definitely a lot more nuanced stuff in checking hormones and all that kind of stuff, but I think that might be a good place to start if you've been trying to conceive for a while.
Very good. Yeah. And I agree. I mean, it's from some months, I mean, you'd recommend at least if you've been trying for over 6 to 12 months, perhaps to start looking into things. So
absolutely.
And that includes the men too, right? Because we have another question about male fertility. So at what point do you say, yeah, the guys, you need to get a semen analysis, you know?
Yeah. So I mean, in my perspective, I like to check the man and the woman in parallel. You know, just for in the interest of being efficient, meaning that I'm going to check ovarian reserve and fallopian tubes, and I'm also going to check a semen analysis at the same time, because it takes two to tango, you know, and you may, you know, sometimes you end up delaying you know, what the proper treatment is because you're doing your evaluation sort of piecemeal. You know, if I do the evaluation for a female and I say, okay, your eggs are okay and the tubes are okay and the you know, and your uterus is okay, so keep trying, you know. But then we, you know, God forbid we do, you know, a couple months later and you're like, gee, it's still not happening. And then I do a semen analysis and I'm like, oh, well, there's the problem. And if we had done that at the get-go, we would have been able to consider something like IUI or something that would have helped. So, you know, certainly if your male partner has a risk factor for having a sperm problem, like if they, for instance, if they are a smoker, if they're a heavy drinker, you know, cigarettes and cigars, or marijuana, or if they have a history of having surgery, like inguinal hernia repairs, or any sort of damage to the testicles or the penis or anything like that, that can certainly predispose someone to having a problem. Or if they're taking testosterone, or you know, that sort of thing, or if an individual male has lots of underlying medical problems like diabetes and hypertension, those sorts of things can sometimes be reflected in the semen analysis as well. So if your guy is anything except, you know, perfectly healthy, even perfectly healthy people can have abnormal semen analyses. But
well, it's a simple procedure. It's like it can give you at least an idea of what
absolutely
on there. And there's a question: should men do acupuncture for fertility too? And so they're. Oh, I was actually I was gonna mention this. If you guys click on my bio, you'll see in the little bio link, the first thing that comes up is actually the updated research on acupuncture and fertility that's been done since 2017. So we compiled it because a couple years back I wrote a book that had research from like 2015 and forward. So that's a lot of studies about acupuncture and IVF and PCOS and endometriosis and male issues. So this, so that's been a while. And so I actually did some research myself, and I put those links in there. So it's on our Instagram bio if you wanted to check those out. It actually has the newest research from 2020 through, it's like 2017 through 2021 actually. And those are actually protocols we use, and a lot of information there, and there's a lot on male infertility and acupuncture now. There used to not be. It was
Yeah.
hard because they're like, oh, well, I know it works, but there's no research, you know. And then there's a lot of research now coming from India. So it's pretty cool how that if you're interested, if you guys like to geek out on research and numbers and all of that, it's really fun to read some of those. So it's the first little thing that pops up on their bio link if you click on their Instagram. So they found that actually when we're doing research and doing acupuncture for male fertility, some things actually improved, and that was actually morphology, which is interesting because they've actually measured it, and like every 70 to 90 days, the new sperm can regenerate. So that, you know, actually was interesting. And then the only thing, it didn't improve sperm, I guess, necrosis, if there was, you know, issues with that. There wasn't any difference with that. And so it didn't have an immediate effect on that. So, you know, if you have a interesting, you know, if you're interested in that, there's lots of Chinese herbs that can help with motility, things like that. So I always think it's good to do. We try to recommend for the guys to come in at maybe like twice a month, if possible, like around that mid-cycle time, or if they're going to be doing a retrieval, maybe the day before retrieval as well. And so that's helpful. A lot of times they'll come in just to kind of relax a little bit too, because they're stressed out as well.
Yeah.
No, they don't say it. It's part of, it's inherent, you know, and it's hard to be the one that's actually kind of taking the brunt of all the stress as well sometimes. So we work with that. And then also blood flow, right? So if there's issues with varicocele or any problems with blood flow there, that's another thing. We don't needle in that area, so you don't have to be worried about that. Lower back, and it's some belly points and some extremity points. But in general, most of the time, if we can have them participate, it's really nice. We work with them on their nutrition sometimes, talk about trying to implement antioxidants into their diet and that sort of thing. So, so yeah, that's a thing that we recently put on our website as well. Those research links. So you guys are welcome to look at those too. Do you have any feedback about the guys or?
Yeah, no, I think I wasn't aware of that sort of emerging research. So I'm gonna click the link in the bio and
Yeah.
and learn for sure. But yeah, no, there's just sort of in general, like you hear a lot of things about, you know, low morphology, which is the shape of the sperm, and there's a lot of data to suggest that sort of environmental exposures, like as I mentioned, smoking, drinking, exposure to high heat, drug use, anything like that can really affect.
I was going to mention sitting all day on the computer. That is what
Oh,
I'm noticing with this pandemic, that
yeah.
working from home, a lot of people and their spouses are telling on them. They're saying, well, they don't ever take breaks. They just sit in front of the computer all day with the laptop near the lap. So I'm thinking not good for circulation and
Nope.
temperature wise. So
Nope. Yeah.
so take breaks, walk a little bit,
Yeah.
you know, things that can help with that circulation because it's not healthy for anyone to stare at a screen all day without taking any breaks or walking around a little bit, stretching, doing some yoga.
Yeah.
So another question that we just saw here, what is a recommended BMI for transfer?
So a normal BMI is what is recommended. You know, so less than 25 is a recommended BMI. There's pretty good data to suggest that those with obesity who have, you know, excessive fat tissue have sort of exist in what we call a pro-inflammatory state because you know, subcutaneous fat tissue is very pro-inflammatory, and that in and of itself can have a negative impact on not only getting pregnant but staying pregnant, and also can have a negative impact on all of my fertility treatments, no matter, you know, how invasive or non-invasive. Those that have an abnormal BMI or even more specifically, those who have an elevated fat mass can in particular have more challenges. And so, we do, we have our nutrition and lifestyle expert, Marta, that, that works with us at IVFMD. And one of the things that she does is a sort of body composition analysis because you can, although it's less likely, you can still certainly be normal weight and have an elevated fat mass. And that in and of itself could be, or percent body fat is, I guess, a better term for it. That in and of itself could potentially have a negative impact. So learning how to reduce that could be really, really helpful.
Definitely. And the next follow-up question was, can a high BMI be the cause of failed implantation?
It's it's not helping for sure. But the direct cause, I'm not sure I can say that for sure without having more information. The idea behind really about doing fertility medicine well is to optimize your patients before they are going through treatment and doing those things, so that you're not left with the question, oh, would it, if I had a normal BMI, would this have happened? Mm-hmm. And so, I can't stress that enough. I know my line is, I know you want this yesterday, but just give me time to figure it out and to optimize you so that you're not left with those questions and the shoulda, coulda, wouldas of treatment when we're talking about something that's so important.
Definitely. We have like the same sentiment there. We're like,
yeah,
a little bit of time, please.
Yeah, no, for sure. Yeah.
And the next question from Stories, I think. I'm 34 with a 10-year-old child. I take a low dose SSRI and my prolactin, I think, is 30.6. Is that too high to get pregnant or maintain pregnancy?
So an elevated prolactin definitely can decrease your chance of conceiving, and I would absolutely get that rechecked. So first of all, it's very important that when you get your prolactin checked, that you do it fasting, that you have your blood level drawn fasting, and then also you need to be careful of having any sort of nipple stimulation in advance of the blood test, because prolactin is the hormone that is used to help generate milk when you're lactating, and any sort of nipple stimulation can sort of falsely elevate the prolactin level. So it's also really important. Normally, when I get an elevated prolactin level, I recheck it again and make sure that the patient has done it appropriately, and then you might have to investigate why the prolactin level is elevated. But I definitely would, I absolutely would, investigate that further, and it could be causing a problem for you.
Okay, very good. Yeah. And stress can bring that prolactin up too, I think, sometimes too. So
absolutely. And to answer another question, it doesn't seem to me as though an SSRI would in any way would be associated with an elevated prolactin, to my knowledge. So just to address that part of the question as well.
Okay, and we just had a question pop up here. I'm taking HCG to help me lose weight. How long after could I start a process to do a transfer? I guess a frozen transfer is what she's saying.
Yeah. So that's also a tough one. I would say probably. I would say probably at least 2 months to make sure that everything is out of your system, and really make sure that you're sort of back to baseline. Certainly, it's beneficial to lose the weight, but it's also important that when you come off the HCG to make sure that you are able to maintain that weight loss, because that's ultimately is going to be what's going to help you to be successful.
Very good. Yes. And we have a few questions here.
There we go. My cycles are typically 28 to 32 days max. This was the first cycle trying to conceive, and I'm on day 34. 2 negative pregnancy tests. I can't see the rest of the question. What do you do?
Oh, sorry. What test should I do?
Oh, so I would say if you you can probably give it a little bit longer. I would say if after 40 days, like give it another week, if you still don't have a period, I would, and you go to your doctor and make sure that your blood test is negative for pregnancy, then you might want to evaluate potentially some reasons why you might be having longer cycles, things like PCOS or something like that. So and also it's always the first cycle that you're trying to conceive when you're nervous and anxious and stressed, and am I doing it at the right time, all this kind of stuff. And then of course your period, your cycle is long, and I feel like that always happens. And if it happens once, it's really not necessarily a big deal. Just try to relax a little bit if you can, and try not to be too stressed about it. Although I know it's a very much easier said than done. I know that for sure. But I would say if another week and you still don't have your period, I would contact your doctor for sure.
Yes, definitely. And let me get to our questions that we've had submitted before, so we can make sure we answer those as well too. Okay, so basically there's a question about I'm trying to conceive, it's taking a while. Well, there's a lot of testing questions. I think maybe we could do a whole Instagram on testing.
I know, right?
Another testing, what should I do first to check if everything's okay? So I guess like taking a while might be more than like 6 months to 12 months or so, or depending on your age. And just to start with, you guys recommend like day 3 to come in and do like blood work during that time, right? So
exactly, yeah, no, blood work, hormone tests, and as well as an internal vaginal ultrasound on day 3 of your menstrual cycle. So actually, while you're bleeding, is the combination of those 2 tests really give us an idea about where a patient stands from an ovarian reserve perspective. So that is definitely a good place to start for sure. And then, to piggyback on some of the stuff we talked about a little bit earlier, checking the fallopian tubes with an HSG can also give you important information. So those 2 things might be a good place to start.
Yeah, sometimes it's like a simple thing. Like if it's simple, it's nice to just have it addressed, like
of course.
and sometimes it's not, but it's good to just, as part of your preconception care, just check it out and make sure everything's okay. And as far as another question we have is, what's the best timing for acupuncture with the IUI? So pretty much we do like to see patients twice a week. It doesn't always happen that way, but we do like to see patients twice a week during any medicated cycle, whether it's IUI or IVF. And so we try to time it whenever it's convenient for you, honestly, whenever you can get in. And then we do a treatment usually like the day of the first IUI. If you're able to do that, like if your IUI is in the afternoon, you can come in the morning or the day before. And then we usually, do treat throughout that cycle. It's just as important, I think, to do treatment after the IUI as before, because, in general, we're working on different things, but again, blood flow is important for implantation as well, and stress relief and all those things. So that's usually what we would recommend to our patients. And then we do treat patients during the first trimester as well. So it's not like, oh, good, you're pregnant, bye, We definitely see patients during that time because we work with nausea, vomiting prevention, as well as relaxation, blood flow, all those things. So that's a great time. It could be a happy time, but also could be a little stressful as well because you're still doing a lot of testing, going through ultrasounds, doing blood work. So we kind of still treat during that time as well. Okay, another question here. For how long are cycles? Is it safe to be on active birth control pills before FET? Could birth control affect the lining?
So this is a very patient-specific question. So birth control pills certainly have the effect of, quieting down the ovaries, and so that we can take better control over your ovaries when it comes to preparing the uterus to receive the embryo. How long is too long? Generally, a minimum of between 8 to 10 days of birth control pills and a max of probably 2 to 3 weeks is something that you should consider. And in particular, if you're someone that has this, and I guess this is more for when you're preparing for an IVF stimulation. If you're someone that has diminished ovarian reserve, sometimes birth control pills can suppress you too much, such that it makes it harder for us to stimulate your ovaries. But generally speaking, if the birth control pills are used in the initial part of a frozen embryo transfer preparation cycle, just to time things out appropriately to make sure that your ovaries don't take over, and to keep them quiet, because then once we start giving you the estrogen to increase the lining of the uterus, we need your ovaries not to think that they rule the roost, so
Yes.
that they take over and that you ovulate, because that can certainly affect the lining. So it's very variable, what's too long, but for frozen embryo transfers, I'm sorry, those numbers that I gave you before were more for in preparation for an IVF stimulation. For a frozen embryo transfer, sometimes people can be on birth control pills for a couple weeks, and I don't think necessarily that would have a problem with your lining. If you have a persistent issue with your endometrial lining, you may be sometimes looking at a natural cycle, or trying to time the start of your preparation for the embryo transfer with your menstrual cycle. That doesn't require birth control pills if you want to try to avoid them, for sure.
Awesome. Yeah, so not everybody is on birth control, I guess, for just everyone's treatment's individualized. It doesn't have to be that way. If you find that you are not a candidate for birth control, because you'd be, like you said, oversuppressed for regulated cycle. Yeah, for frozen embryo transfer, you guys also use Lupron, right? And then and then as far as okay, we have a yoga question. Yay! Can I do yoga and body weight exercises during the week following, or the 2-week wait following an IUI? Do you have any input on that?
I say yes. I say go for it.
Yeah, I mean, yoga, there's a restorative, which is actually really gentle. Like we've been doing a few Zoom sessions, which has been really fun. And it's just basically just, a really relaxing type of yoga. It's not like a cardio. So like anything that doesn't elevate your heart rate too much, like too much all out cardio, circuit training, Orange Theory stuff. We usually don't recommend that, but I don't, but otherwise, like light weights should be fine, I think, right? Like
I agree totally. Yeah,
good for stress relief and all that, endorphins. And then someone asked, do I have to get acupuncture on my belly to support fertility? I hate having my stomach touched.
I saw that one. That one was cute.
Yeah. So it's really nice to actually do acupuncture on the abdomen when you're trying to affect blood flow there. It's not always that we do it. Sometimes we do back treatments. Sometimes we'll use cold laser. So there's laser points that you can use for patients that are extremely needle phobic and they don't want any needles at all. It can be effective, but definitely there's definitely ways around it. We use shorter needles for patients that are very sensitive. So half inch, they're like half-inch 36 gauge needles. They're really thin. And those can be one of the alternatives. Like if you're just like, I don't want needles there. But there's also lots of distal points you can do. You don't have to do directly to the abdomen. There's 360 something points in the body. So we have lots to choose from there.
Yeah.
Okay, so we have another question here. Okay, someone wants 2 embryos transferred. Is that allowed?
So again, sort of a loaded question. It depends significantly on the patient. It depends on their age. It depends on the quality of the embryos. Generally speaking, we always err on the side of putting 1 embryo back at a time, because far and away what is safest for mom and baby is to have 1 baby at a time. You're at like 7 or 8 times increased risk of developing complications in pregnancy when you put when you have more than one baby, if you have, twins or God forbid triplets. And the problem with putting back two embryos is not only could both of them take, but then each of them individually have a potential to split themselves. So you could end up with four babies, and that certainly is not ideal in any way. We have definitely moved away from doing that. And almost never do we put more than one embryo back, especially if those embryos are proven by genetic testing to be what we call euploid or genetically normal, because the rate of success with those euploid embryos is so high that the rate of twins and multiples or high order multiples would be extremely high if we were putting back more than one genetically normal embryo. So almost certainly never, if your embryos are genetically tested, will we put back more than one. If they are not genetically tested and you're a little bit older, I would say, at least over 37, 38, into your 40s, then sometimes two is considered, but it's really a decision made on an individualized basis.
Yeah, and with that higher of a pregnancy rate, I mean, it's high, like if you get to a frozen embryo transfer with genetically healthy embryos, there's a really high likelihood, that
Yeah.
it works. So, I mean, when you're gonna get to, if you put two in, right? So, I mean, that's what we see anyway.
Yes, for sure.
We used to see so many twins and multiples many years ago, and we had a patient with two embryos put in, one split, so she had triplets and she carried a term. But it's definitely not without risk, and you
Right.
need to see patients who are babies in the NICU and that sort of thing too. And I know you guys hate to see that, so
Absolutely.
that's one thing. But and another embryo question here. So if the embryos that will not achieve day 5, what do you do as an alternative? I'm not sure I understand that, but don't achieve day. So if they're not like growing, I guess, to
right. If they're usually what happens, so very rarely are we putting, number one, we're very rarely putting embryos back fresh. Okay. Almost always embryos are being grown out to day 5 and then frozen. And then at a later time, the embryos are thawed and put back. And that is definitely the vast majority of at least the embryo transfers that we do at IVFMD. So generally speaking, it's if an embryo is not going to make it to day 5, then the likelihood of it being able to provide or to create a healthy pregnancy is also is lower than an embryo that makes it to day 5 very successfully. We used to, I don't particularly do it anymore, but back when I was in training, if we saw that there was very slow or poor embryo quality or anything like that, we would consider putting the embryos back in on day 3 if we thought that they would do better, inside the uterus compared to continuing to grow in the incubator. But I can tell you I haven't done that in years. So because sort of our data has changed and what we've learned about how embryos grow and develop and how much better they do when they're at the blastocyst stage, which is the day 5 stage, how much better they do compared to the day 3 stage. So that's before you go through that, that's a discussion that you should have with your doctor so that you have a very clear plan in place.
Definitely, and I guess that's definitely specific to those clinics as well. Like some clinics will do a lot of day 2, day 3 embryo transfers for women who are over 35 or over 40. I want to say like they're doing a little bit more IVF treatments, for women that are and I guess diminished ovarian reserve or that sort of thing where they're not retrieving a lot. So, but again, I think it's really important to check the success rates of those clinics and see on SART how successful those transfers are, because it will tell you, right, according to range, what their fresh and frozen success rates are. So that's SART.org.
Yep, SART.org. Absolutely. Educate yourself, people, for sure.
Yeah. Yeah, and okay, we have another question about, actually, no, this is the first question. Ectopic pregnancy treated with injection, what are the chances for tubal damage? So it's methotrexate.
Yeah, that's a tough one. Ectopics are such a bummer. And you know, the it's a little hard to say. I've seen it both scenarios. I've seen people who have ectopic pregnancies um, have who have used methotrexate and have done just fine, and I've also seen tubes ultimately become damaged because of it. The very best advice I can give to you, if you've had a ectopic pregnancy treated with methotrexate, you absolutely need to have an HSG done before you start trying again, because that will really give you an answer as to what the status and health of your tube is. And understand that when you do have an ectopic pregnancy, you're unfortunately at increased risk for having another. And so it's very important that if you find out that you're pregnant, to get into the doctor and see them early so that they can do an ultrasound and make sure that the pregnancy is in the right place. But like I said, if the pregnancy was relatively early on and it was caught, as being ectopic, and you use the methotrexate, I would be hopeful that, that tube would go on and function just fine. But it's really important that you check before you start trying again.
Super. Yes, definitely. And Bella is asking, congratulations. She's asking about, does miscarriage risk decrease after hearing heartbeat at 7 weeks? She's 30 years old, no history of miscarriage. This is her first pregnancy. So
Absolutely. Yeah, no, once you have a great heart rate and an appropriate heart rate, the rate of miscarriage goes down significantly to, less than 5%, I would say. And so that's great. Congratulations, first of all. And yeah, so, there are no guarantees in life, but I think having a really good heartbeat at 7 weeks is a really, really good sign. So congratulations.
awesome. And you guys usually do a 6-week and a 9-week ultrasound, right? Before you release your patients back to their OBs, or
Yeah, also a little variable. Some
Mhm.
patients need to be seen, every week. Some can go every 2 weeks, and some want to stay longer than others.
Yeah.
It's very bittersweet to graduate patients from our office back to OBGYN care. But it's individualized, but usually at least 2 ultrasounds in early pregnancy before we send them back to their OBGYN generally. Yeah.
And we have another question here. Is cycle day 3 estradiol level of 11 normal for a healthy 31-year-old female with regular 28, 29-day cycles?
So it can be. It What's more important is understanding what your follicle stimulating hormone, or FSH, is as well, because estrogen is one thing, but your follicle stimulating hormone and your luteinizing hormone are also really important, and they should be, we'd like the estradiol to be, less than 50 on, cycle day 3, and your FSH should ideally be less than 8. And your LH can be a little bit variable, but generally, around 6, something like that. And so I'd recommend getting the rest of those tests done as well. But an estrogen of 11 on cycle day 3 could seems reasonable to me.
Mm-hmm. Very good. Okay, and we just have a question pop up in the chat here. Second 10-day antibiotic therapy due to
Enterococcus on vulva cyst.
How long
How
should
long?
I conceive?
Well, you definitely want to have this infection behind you, and also depending on what antibiotic you're on, that antibiotic might not be safe in pregnancy. So I would say that you can, an easy point of measure is once your infection is resolved, wait 1 menstrual cycle and then get going again.
Yeah.
I think is reasonable to be on the safe side.
That's why it's important, is these infections, I mean, like the endometritis, sometimes you guys see, like, it's like they're hidden sometimes. Sometimes there's no symptoms at all. So
Right.
it's good to get those checked out for sure, because that's
Absolutely.
easily treat usually. Okay, and then we have a lining question here. Okay, so if you have a thin uterine lining, will a Provera letrozole cycle work?
a Provera letrozole cycle work? So I presume you mean Provera to bring on your menstrual cycle is what I'll assume that that means, followed by a letrozole cycle. So yeah, absolutely. A thin lining that could work. The thing about a thin lining is you might not respond, you might not be able to initiate your period with just Provera. Sometimes if you have a thin lining, that's indicative that your estrogen levels are low. And sometimes you need a combination of estrogen and progesterone to induce a period if you don't get a period on your own. So it's reasonable to try to use the Provera first. That's definitely like our first line treatment. But if you are someone that has a very thin lining and don't get your period on your own, you may need either sometimes a birth control pill, which has a combination of estrogen and progesterone in it, will be able to initiate your menses so you can start a letrozole cycle. Or sometimes patients need a more prolonged course of just estrogen followed by progesterone to get that menstrual cycle to come on, so that you can use the letrozole. So it's perfect. That absolutely could work in the right scenario.
And is there a case where you just don't get your period at all and start letrozole? Like, would there
You
be?
can,
Yeah.
you can absolutely. If you're someone that doesn't, that doesn't ovulate on your own, it's not required that you have a period before starting letrozole, but it is important that we check to make sure, again, that the lining is relatively thin, and that of course you're not pregnant before starting the letrozole cycle. So it's not a requirement to have a period before starting ovulation induction.
All right. Oh my gosh. I think we are doing so good with these questions.
Yeah, look at us go.
And then we have less than 5 minutes left. So
Yeah.
let me see what else we have gotten to. Okay. Does acupuncture help regulate cycles? We talked about that. Support spotting 1 week before period due. If you're having spotting before your period, it could indicate other imbalances as well. So like progesterone being low, or endometriosis, things like that. So I think that's important to, if that's happening a lot, like you need to address the cause, again, like looking at a little bit of detective work to figure out what's going on. And sometimes it'll just go away on its own, and acupuncture can help with that. But sometimes you might need like a little progesterone, or you might need, to address, if it is endometriosis, those issues. And so, and it might be, who knows, other causes, but definitely I would look into why that's happening, if, for sure, if it's happening, right?
Absolutely. Yeah, for sure. There are lots of reasons why that can happen, and there can be, it can be a very easy fix, or something might be something a little bit more complicated. So if it's happening persistently, I would say for more than 2 menstrual cycles, I would definitely get that checked.
And then there's a question on how can I increase my positive embryo transfer rate, I guess, or success rate, I think.
You can increase your success rate by making sure that you're at a fertility clinic that has excellent success rates. It's really important to do, but things related to your doctor should be checking to make sure that your thyroid is normal, that your normal body weight, that you don't have any pro-inflammatory scenarios, that your natural killer cells are low, that you don't have any predisposing what we call antiphospholipids that might be elevated, that might require baby aspirin or something like Lovenox which is a blood thinner, to aid in increasing the rate of transfer. So there's lots of things you should be working with your fertility doctor to really fine tune things, and again, sort of the theme of really optimizing you before getting to that embryo transfer, to really to be successful, to improve success.
Definitely. Yeah. And and we focus on more of the lifestyle, I guess, issues where, to help with, again, like nutrition, blood flow, all those good antioxidants that you could also try to help bathe those follicles in antioxidant and the best nutrition you can give them, so that they can go on to do better things and grow. and you know, that's kind of the part that we like to focus on. But definitely there's you know, the best place to start is actually figuring out like what's going on, and don't just like rush into the cycle, because I think that is done in certain places and certain parts of the world too, where like I was taking that course with the doctor from Austria, and she said it's very common for them just to just start an IVF cycle right away, because it's sort of cheap there, and it's easy to find, easy to get to, and there's no prep time, and then they repeat the cycles over and over and over again, and it's heartbreaking.
Yeah. No, if you just take a step back for a second and slow down just for a second, and really take a look and be comprehensive in your evaluation, I can guarantee you're going to be more successful than if you just run right in and do IVF sort of willy-nilly and not look at all the factors, because there's so many things that go into being successful with IVF, and you really need to make sure that you're with a doctor that's looking at all of those things.
Yeah, and now they're finding out, now the research is coming out that preconception care is really important. I mean, I don't know, I posted this on our Facebook. They just found out the low testosterone might be equated with the offspring having endometriosis. So the mom's testosterone levels could be equated to the, to the daughter having endometriosis. So I think that is very interesting that they're finding these things. And PCOS is kind of the opposite spectrum, where the testosterone is too high during pregnancy. That could definitely affect your offspring, their offspring, all these generations of kids. Not to be paranoid, but it's good to have those.
It makes a difference. It makes a difference.
Yeah. So in the future, we'll probably see treatments that are more geared towards that stage to kind of help prevent some of these issues that we see now. So I think that'd be the future of medicine.
Absolutely.
I think that we are almost out of time. So we have one more question that popped up here. When in the workup process do you check natural killer cells?
So it depends. If I have a patient who has maybe her history, her medical history, or her pregnancy history suggests to me that there's some sort of, immune process going on, then I check it earlier. Otherwise, the very latest that I'll check it is just in advance of doing a frozen, or in advance of doing an embryo transfer. That would be when I would check it. So it depends on the patient. Either I do it at the get-go, or I wait until we have an embryo to transfer, and then I check it.
Okay, very good.
And it's just a blood test.
Okay, yeah, I was gonna say sometimes it's checked in the lining as well, though, right?
Experimentally for sure, but the at least what I do for natural killer cells, I check blood levels.
Okay, awesome. Yes, and that I think is it, everyone. I will just make sure to check. Let me make sure. Okay, answered. Yay, we got to
them. Okay, we're good. And look, we're great.
We did it.
Thank you.
So thank you guys so much for submitting your questions. Thank you, Dr. Bauer, for taking time out of your evening.
Of course.
And to answer everyone's questions.
My pleasure.
We'll be back next week with another Q&A if you guys didn't get your questions answered. And we'll continue to help you guys in whatever way we can. And if you need to reach out to us, please don't be shy. You can do that. You can do a consult if you need to, or just message us as well. I think on yours or IVFMD's message. You can do direct message also.
Absolutely.
Well.
You can also follow my handle. I'm Jessica Bauer _fertility doc. So feel free to DM me if that's more convenient for you.
Definitely. We're here for you.
Yes, absolutely. All right, everyone. Well, good night. It's been such a pleasure.
Fun.
Okay.
Bye. Thank you, Dr.
Bye.
Bye.